Welcome to the Lionbridge podcast. My name is Rebecca Wilkie, and today I will be having a conversation with Susan, who is Director of OPI Sales here at Lionbridge. Susan, could you just give a quick introduction on yourself, and then I'd love to dive right in.
Sure, I'd be glad to, Becky. I'm Susan Greider, and I'm currently working as the Director of OPI Sales for Lionbridge. And I've actually been in the industry my whole career, including working with Lionbridge since 1997. So I have experience in all different aspects of providing over-the-phone interpretation to our customers in a variety of settings.
Thank you. So today, like you mentioned, we wanted to talk about a topic that has become even more relevant lately, which is over-the-phone interpretation,
Mhm.
specifically for healthcare and community. So Susan, can you explain what do we mean by community interpretation?
Well, community interpretation is providing interpretation for individuals who are what we call LEPs, or limited English proficient people, as they move through their lives in the community. So it's a bit different from providing interpretation for, say, a business or a call center where people who call in are using a particular product or something like that. This is just everybody in a community with all the languages that they speak interacting with government and healthcare and other things that they need to conduct their daily lives.
So what does this mean for the kinds of languages that are prevalent in healthcare and community interpretation?
Well, that's an interesting question because a lot of us think about interpretation. We think about interpreting in French or German or Italian, and in healthcare and community interpreting, that's not really the case. There is, of course, a lot of Spanish interpretation that's required because we have so many Spanish speakers in our country, and they sometimes will require interpretation. But the language list is really much more extensive than that, and it represents all of the different communities that live in our communities and in our country. And it really varies from location to location. A lot of that is dependent on immigration patterns because, of course, people come to the United States and they tend to move to places where there are people they know, relatives, or they know there's a community. So, for example, we might provide a lot of Somali interpretation in Maine, and in Minnesota, we might provide a lot of Hmong interpretation. And then in Los Angeles, a lot of Armenian interpretation. So those are languages that are prevalent in those communities and where those speakers need interpretation. But it really varies a lot. From location to location. We find that if you look at the US overall, there are 380 or so languages that we've provided across the country, and some of them are really only needed in certain areas, and some of them are prevalent everywhere.
That's great, thank you. So is the preparation and training for healthcare interpreters different from other interpreters?
It is. As you can imagine, if you're a healthcare interpreter, you need to have a lot of very specific terminology that's medical. You need to have understanding of medical procedures, and really what happens in, for example, a visit with a doctor or preparation for surgery, or if you have to go to the emergency room. Those are all situations where an interpreter might be needed. And because the situation can often be life or death, the interpreter needs to be ready for any kind of medical terminology that's needed. Even beyond the terminology and the understanding of the subject matter, interpreters who are healthcare and also other types of community interpreters need to have good training so that they understand how to react in high stress situations, how to fulfill their role as an interpreter, as an unbiased communicator, when the situation is stressful, or when it's something where someone's life or well-being is involved. It's a very high stress kind of situation, and one that requires great skills, great confidence, empathy, and a good command of the terminology and the situation that they're going to interpret for.
That's a great way to describe it. So kind of shifting gears a little, what is a cultural broker?
Well, it's a very interesting question because normally when you think of an interpreter, you think of someone, rightly, who is charged with providing an unbiased and unaltered interpretation of what happens. For example, if you are an interpreter in court, you are interpreting for the record. So what you say has to be very accurate and very precise, and also your feelings shouldn't be inserted, or your opinion shouldn't be inserted into that proceeding. The same is true in healthcare and community interpreting. An interpreter is an unbiased renderer of the message between speakers. Uh, there is another aspect of healthcare interpreting, though, that's really unique to healthcare, and that's that occasionally an interpreter will be asked to be what's called a cultural broker. And in that situation, an interpreter may be called upon to explain to, for example, a doctor what some of the cultural implications of a patient's behavior or what they say might be. And it's very tricky for an interpreter because they need to be able to provide that cultural background information that allows a doctor to do his or her job, but they can't let it roll over into expressing an opinion or advocating for a particular treatment or anything like that. So it's a very tricky line that interpreters are often asked to walk in a healthcare situation. So again, that speaks back to the real importance of providing good training for the interpreter, so they have solid footing in their own role in the interaction, and that they can provide that cultural background information if requested, but they know how to disclose that that's what it is. They know how to make sure to keep their own feelings and opinions out of it. It's a very tricky line to walk for the healthcare interpreter.
It sounds like they have to deal with a lot of tense and traumatic situations. Is there anything else that they do in healthcare and social service calls?
Well, they absolutely, a lot of the situations that they work in are very, very tense. And we can all imagine that that's true for healthcare, but you can also imagine that a social service call, for example, that has to do with child protective services or domestic issues, any of those things can be pretty sensitive, and the interpreter really needs to be prepared for them and know how to manage their own emotions, and at the same time convey the emotions of the speakers in such a way that everybody understands what the speakers are feeling and what their emotions are.
Thank you. So, what has the impact of COVID-19 been on interpreters?
It's really interesting. For over the phone interpreters, in some ways things haven't changed because they're still working over the phone. So they are the original remote interpreters. So they've been able to continue to work during the pandemic and provide those really important services. I think that in many cases they are asked to interpret a lot more difficult and sad situations than they have before. We've had a lot of interpreters say this is so hard when, for example, they're interpreting for a nursing home and the person who's the resident of the nursing home is afraid, and their family can't visit them, and it's just a very fraught and sad situation. And I think that's really worn a lot on interpreters. The constant having to deal with these very difficult family situations is hard for them, and I think interpretation has become, during the pandemic, even more of a really challenging and important profession, and certainly they feel for the people they're interpreting for, and understand what a difficult situation it is.
Thanks, Susan. And knowing all this, what do you see as the future of healthcare interpretation?
Well, I think that certain things that have become more prevalent during the pandemic, like telemedicine and more remote administration of healthcare, I don't think those things are going to go away. Even though people are eager to get back and see people in person, I do think that a certain amount of remote and video provision of medical services will continue, because it's a good way to get, for example, if you need to see patients in a more rural area where there may not be that many options for healthcare, if we have a robust system of telehealth that people can call on, that's a way to address part of that problem. And interpreters will also always be a part of that. There are plenty of speakers of other languages, even in rural areas, where they will need to call on an interpreter to help them have that appointment. So I see that the remote aspect of healthcare delivery and the need for interpreters that go along with that is not going to go away. I think it's going to just be a new mode of delivering services that we'll all become more comfortable with in the future and continue to use.
Can't wait to see what happens. And Susan, thank you so much for joining me today. It was a true pleasure learning more about over the phone interpretation and how this can be used in a community and healthcare setting. To our listeners, be sure to tune in again to learn how you can break barriers and build bridges with Lionbridge. Thank you.